Thank you, Gloria. And hi, everyone. I think this has been a really great morning of talks so far. I know that I've learned so much, and I hope that we can keep that going now in our next session. So I want to welcome you all to our discussion panel on how to improve mental health through nature-based interventions. So just for those who don't know me, I'm Sara. I'm an assistant professor in the Department of Biology here at MIT and a new investigator with the Picower Institute for Learning and Memory. And my lab works on the peripheral circuits that help our body sense and respond to different types of visceral insults. In particular, we focus on the mouse respiratory system. And it is my honor to moderate the session today. So I think we have a really exceptional lineup of experts here this morning who I'm going to introduce in a second. But first, I just wanted to broadly introduce our subject matter. So the purpose of this panel today is to examine how engagement with nature can be used to promote well-being amongst our most vulnerable populations, in particular children. So I think we all can appreciate here that modern urbanization has created some unique health challenges, and this includes a global shift in burden from acute childhood infections to more chronic, non-communicable diseases, including mental health disorders. And studies show that children today are faced with unprecedented levels of stress, anxiety, and depression. And engagement with nature through structured programs is becoming increasingly recognized as a means to alleviate many of these challenges. And so the goal for our panel today is just to open up conversation about this very important topic. And I think we'd like to revolve around a couple different themes. So in particular, we want to draw attention to some of the research that's being done in this area. We want to consider how differential access to nature intersects with global health disparities, discuss barriers to widespread implementation of nature-based programs as tools in our clinical toolkit, and also puts forward some specific recommendations for how we can actually put this knowledge into practice in our own community. So with that, I'll just briefly describe our structure for the session today. So we're going to hear very short presentations from each of our panelists, and we will open up the floor afterwards for questions. So if you have any burning questions about that particular talk, feel free to ask them then. But then at the very end, we're also going to open up once again for sort of a more broad discussion. And it's really meant to be quite interactive, and I hope that you all will participate in this because I think it'll create sort of more engaging and thought-provoking conversation. So without further ado, I'd like to introduce our panelists. So first we have Nsedu Witherspoon. She is the executive director of the Children's Environmental Health Network, which is an organization that focuses on protecting children from environmental hazards through advocacy, research, and education. She serves on the External Science Board for the Environmental Influences on Child Health Outcomes program through the NIH. She is a co-leader of the Health Science Initiative at the Cancer-Free Economy Network and co-chair of the National Environmental Health Partnership Council. She's also the board chair for the Pesticide Action Network of North America, a board member for the Environmental Integrity Project, and serves on the Maryland Children's Environmental Health Advocacy Council. We also next have Gregory Bratman, who is an assistant professor at the University of Washington and director of the Environment and Wellbeing Lab. He is a JPB Harvard Environmental Health Fellow and the Doug Walker Endowed Professor. And Greg's research focuses on how urban environments influence cognitive function and emotional regulation. And lastly, we have Sara Milligan-Toffler, who's president and CEO of the Children in Nature Network, which is an organization that works to connect children, families, and communities to nature through research, education, advocacy, and networking. And prior to her work there, Sara served as the associate executive director at Wilderness Inquiry for 23 years. So thank you all very much for coming here today and telling us more about your work. And with that, Nse, you are up first.
Good morning. We're going to jazz it up a little bit here and hopefully get you guys pumped up because I know we still have lunch and a wonderful afternoon session. Really have appreciated what we've heard this morning. The public health advocate in me says, please stand up, stretch, do what you need to do just to kind of keep those neurons firing so that we can have this robust discussion. Thank you so much. So as was mentioned, the Children's Environmental Health Network is a national nonprofit. We're celebrating 31 years. Our founding director, Joy Carlson, would have never thought that we would have needed this organization 3 decades later, but I would say our mission is needed more than ever because now we have peer-reviewed science that, in my opinion, and opinion of many others, is not being applied, is not being translated into public health policy and child protective policy and public health actions. We are considered the leader, if you will, in the children's environmental health movement, and we are actively engaged and brought in often to be that child health voice at the table. We are actively working to translate and educate and train, and for example, in the science arena, we serve as the coordinating center for the Children's Environmental Health Research Translation Centers funded by the NIH. This work is tough, it's frustrating, it's hard. There's a lot to cover. These fields are all connected. All of these topics we're talking about and many others all come back to children and their current and future implications in this life. And then if they're women, their future children. So I call often on folks before me, and here we have Nelson Mandela, who has said there can be no keener revelation of a society's soul than the way in which it treats its children. So I encourage all of us to just continue to think about that and wonder if we, have really done all that we can. I think the answer is what we know. There's so much more to do. And what's nice is there are many resources and tools available and partners. So our environment, we say, is a chemical toxic soup, all of us. If we were to have some biomonitoring, even from birth, unfortunately, know that we are exposed to a wide variety of chemicals. Many of them are known neurotoxicants, as well as carcinogens, for example, and many other co-negative impacts. We know that children are not little adults, right? But yet, in this country anyway, we retroactively always wait until kids get sick and then try to figure out what caused that sickness, instead of proactively promoting primary public health prevention and doing what we can to not continue to perpetuate those same cycles of harm when those children have done nothing to cause that harm to themselves. We know that their little bodies were never made to metabolize these harsh chemicals. We know that when exposed to the same level of exposures like pesticides, for example, a known neurotoxicant, adults may not fare as poorly, but children, of course, have lifelong implications. So again, these windows of susceptibility, as we've been hearing today, are really critical. So you'll see around week, 8, 9 or 10, the brain is starting to develop. And as we all know, hopefully the brain continues to develop into toddler years. So what that child is exposed to in mom's womb, in their early learning childcare facilities, in their K through 12 schools, in their homes, just to name a few, is extremely important. And as has been discussed, we cannot forget the exposures of prenatal implications. Mom's womb is the first environment for a child, and as we now know, it's not just mom, it's also what dad was exposed to younger in life, which can be showing up in his own children. We do have peer-reviewed science to show us that some pesticides are linked to fetal growth and neurodevelopmental concerns, phthalate exposures to premature birth and impaired neurodevelopment, fine particle air pollution, as we've been talking about, altered expression of genes and influencing neurodevelopment. And we started out training and educating healthcare professionals in the late 80s, early 90s when we first got started. And unfortunately, there still is not a standardized way of training our healthcare professionals on what they can be looking for in a well child visit or a well woman's visit to then indicate and trigger these concerns for additional follow-up. So while this slide may seem old, unfortunately it's still very current. This is from A Generation in Jeopardy from the Pesticide Action Network of North America. So you'll see all the trends are going the wrong way, especially the developmental disparities and autism, spectrum disorders and whatnot. And what we know is that environmental influences are connected to each and every one of these negative health outcomes. Just unpacking autism for a minute, just in 2023, the CDC has identified from 2020 data that 1 in 36 children now are being diagnosed with some type of autism spectrum disorder. So it's not genetics. We know that there's something else happening here. We must acknowledge the environmental contributions to these negative health outcomes. And of course, there are some underlying factors here, of course, that are making some of our children even higher risk than just being a child themselves in this society. We know that our BIPOC communities are more likely to live in fence-line communities, to be exposed to these hazardous waste facilities, polluting facilities, and potentially to be living in substandard housing. I recently joined with Jackie Patterson with the Chisholm Legacy Project, and during the COVID pandemic, we embarked on this very emotional journey to write this piece called Racism That Appends the Cradle. So in this case, we're looking at the syndemic, so economic disinvestment, COVID-19 pandemic, and climate injustice, and how this has been impacting Black children specifically in the United States. Whether it's redlining practices, whether it's environmental racism, whether it's structural racism in our education system, our criminal justice system, you name it. Unfortunately, there's time and time again too many on-ramps for Black children in this country to fare the worst before they even get a chance to connect to their full potential, and that's before being exposed to various types of harms and trauma and stress. Poverty also, of course, is the elephant in the room. 1 in 6 children live in low-wealth families. We know that child poverty rates are some of the highest in our Black, Brown, Indigenous communities. And across the United States, there's a discrepancy, right? It's not standard by any means. So if you're in Mississippi, you're looking at about 32% childhood poverty rate. If you're in New Hampshire, roughly 11%. Either way, it's way too high. And those implications are huge. So even the World Health Organization, we do work on the global level as well, has made it very clear children's environmental health needs to be addressed. This is a huge problem throughout the world, and we would look at ambient air pollution and impaired mental and motor fine skills and behavioral disorders in what should be the normal function of our brain, along with even death and mortality. These are serious implications that are being seen around the world. So in some cases, we have to work really hard to work in our partnerships and our collaborations to expand our work. One of a few of these collaborations is the Cancer-Free Economy Network and the Childhood Cancer Prevention Initiative. So this speaks to many of the co-benefits, right? There are many co-benefits, including economic benefits, to preventing these exposures in the first place to children and even their parents before them. And this is a report that we released a couple years ago that does get into trying to focus on preventing cancer and long-term illness, using peer-reviewed existing science, and not negating that we need treatment, but understanding that we have not even begun to invest in much further upstream. When we do that, we have the co-benefits of reducing long-term illness, increasing benefit of our health and safety in our climate and our environment, and obviously protecting children overall. Our Eco-Healthy Childcare Program is the only program in the country working to train and educate childcare providers, facility managers, and owners on how they can create healthier, safer environments in the critical stages of anywhere from 6 weeks to 5 years that a child in the US generally enters some form of childcare, aside from the COVID height years. That's something like 60% of our children under that age during those brain development times that we've been talking about. So we provide a lot of on-ramps for how important it is to get kids out in nature. We never tell them do not take kids out. If you're in an urban environment, maybe think about the best times to go outside versus when commute time is happening. We try to give them just technical advice and guidance, but the answer is never do not take kids out. It's rather how do we adjust our time right now while the policies and public health standards are hopefully coming behind us to make much better circumstances for all. Also, I'm honored to be the co-chair of what's called the America the Beautiful for All Coalition. This is working to really implement a very audacious and big goal that the Biden administration has to conserve at least 30% of our wetlands and our public lands and our waters and our oceans and private lands from industrial pollution and atrocities, and to make sure that at least 40% of those protected areas are benefiting those that have been most marginalized and most impacted, but not really contributing to this in the first place. It's huge. We've got a lot of indigenous leaders and community voices, but there's many more. Welcome anyone who wants to join us, but we're very serious about meeting these goals, and clearly there are huge connections to nature as well as health and justice benefits there. And I would be remiss without saying that climate change is one of the biggest issues facing our children. It certainly exacerbates the justice issues, the health disparities issues, and of course, combining with the chemical exposures, we cannot do one without the other. I do worry that there's so much emphasis on one or the other, we need to be doing work simultaneously if we truly are trying to create the type of system that we have yet to really see. Just this week, Luz Claudio at Mount Sinai and many colleagues released this Prescription for Children in Nature report, which I thought was very timely. They talked about renaturalizing school spaces and promoting greener school environments, that there's a great variation. They did a systemic review of programs that are out there and the ways and methodologies that schools are using, and confounding factors were varied across these studies. They suggest that we need to standardize approach for delivering childcare and school environmental health interventions to benefit our children. There are too many positives and the negatives to that, but they definitely need to be amped up, supported, funded. Project Learning Tree is another program that's been around for at least 40 years, connecting resources and available tools and evidence-based practices to teachers across the country. And they also have an early learning program, which I love. They haven't forgotten our youngest kids, bringing support of how they can bring environment into the classroom and how kids can be brought out into environment to really excite their energy, their environmental stewardship, and of course, their connection to nature. And finally, we have a children's environmental health movement that we've been leading. We welcome all of you to join us. There's room for all of us. There are many aspects of this work, but for example, we have Children's Environmental Health Day every second Thursday of October. It's a day of action for and with our youth. So it's many events that are posted. We invite folks to come and post things that you're doing because other people are going and looking at that. They're modeling approaches. They're getting innovative ideas and creative strategies that they can bring to their communities. And many of them are connecting kids and nature, so they're really good to watch out for. And these are our Children's Environmental Health Network kids. 4 of them are mine. Just a few of the millions that keep me motivated every single day on those hard days when I'm always wondering why we haven't moved forward on more protective policies in a more expeditious, urgent way. But I am very hopeful with the generations coming behind us and again, the partnerships and discussions like this today to know that we're going in the right direction. Thank you.
Yes, thank you so much. My name is Anna Garnica. I'm coming from New Hampshire. About 15 years ago, I moved from Mexico City. I am the minority in New Hampshire among other. I am the only freehold in New Hampshire. So one of the challenges for me is diversity. It's about diversity. I got married to an American person. We had 2 kids. However, trying to raise my kids in a bicultural world is a little bit challenge. For them to speak was a little bit challenge because I spoke to them in Spanish because I speak Spanglish. So there was a delay in the speaking. Growing in a bilingual world, you can sense that the kids are growing in a little bit introvert because they are afraid to speak. They are not structured their words correctly, so they are a little bit shy and introvert. Later on, my daughter is in middle school, but she has been growing in this introvert world. Susan Cain, this is a professor of Harvard professor at Harvard University. She made a research about introvertism, and I was totally in love with her material. I totally love her material because my daughter, as an introvert, she has approached too many goals in her life in this young age. But the teachers were telling her that she needs to get out of her shell, and she needs to be more sociable. And even though they tell her that she has mental health, and she is criticized and she is sent without my consent to these mental health programs because she does not speak or she doesn't socialize in these environments. For me, it's a little bit challenge how to tell diversity, personality diversity is something that is not in the agenda, is not known. Personality, the gender, personality diversity is more important than, or equally as important than gender diversity or the racial diversity. But personality diversity does not take any room in anywhere. So people that introverts are criticized as that have mental health, and it's not the same. So I would like to see if your organization has something involving about the personality diversity, because in this aspect of radio, how people can see that people that don't talk are introverts. More than the half of population in the United States are introverts. Yeah. And that doesn't mean that they have need mental health. Is there some room in your agenda? Because quite honestly, when my daughter comes crying because she said, they say that I have a mental problem. So I really don't know how to help her. And I get involved in the school. For me, it's touching bases that she comes devastated because teachers are telling her that she needs to socialize.
Yeah.
So
No, thank you so much. There's a lot there, and I would think that we can maybe unpack some of that in the discussion coming up as well. But personality differences, cultural differences, many different things, and these self-imposed norms. There could be a child that obviously has an actual diagnosis, and there's already a stigma placed on that child. There could be the child that never was diagnosed and is dealing with some of these challenges and was never understood, given resources. And then there could just be the personality who is just an introvert. So we do not do work in this space, but you have totally enlightened me today. In 24 years, I've never gotten a question on that. So I really do appreciate it. I will do more thoughts on, how we can serve as a leader or offer our platform and in other ways for those differences. So I really do appreciate that.
Hello, everyone. Well, I'm really honored to be here. I'm excited to be here. The talks thus far this morning have been so interesting and exciting and cross-pollinating in so many interesting ways. So I'll tell you who I am. My name's Gregory Bratman. I'm the director of the Environment and Wellbeing Lab at the University of Washington, and I'm a JPB Environmental Health Fellow. I'm assistant professor of nature, health, and recreation. So I work at the sort of intersection of ecology, psychology, a little bit of epidemiology, and public health and other aspects, exposure science. And I study the ways in which nature experience leads to human well-being. And I want to acknowledge right off the bat that the approaches I take are very Western with respect to the assessments and methodologies that I use. So to start with a quick situating of the work I do in nature and health, I consider natural landscapes as part of the total environment, some parts of which we experience on a regular basis in childhood, depending on where we live. And as we know, the total environment, and as we've heard about today, contains a variety of physical and social factors that can influence developmental trajectories in both good and bad ways from childhood on. And a large body of evidence has shown how social environments and experiences can lead to adverse outcomes through complex, sometimes nonlinear pathways. And there are also complex sets of impacts from aspects of physical environments and exposures as well. And together, these exposures can lead to a variety of adverse health and ill-being outcomes, some of which, again, we've heard about already today. And here's just a partial list. And as my colleagues, Dr. Olvera Alvarez, Dr. Allison Appleton, and others from the JPB Fellowship have described, not only do these elements negatively impact health on their own, but interactions between them can cause exponentially more damage in some cases. So social stress, for example, may increase inflammatory responses to air pollution exposure. So it's important to think about where and how we can intervene within these environments in ways that may buffer against their impacts, and in some cases perhaps maybe even help address or moderate those challenging interactions. And so what are ways to both, say, decrease stress and air pollution with a population level intervention? Well, the physical environment offers opportunities for some interventions, though of course they're limited in some important ways. But even relatively small changes in the physical environment represent opportunities to impact well-being at an early age through the incorporation of urban green space, nature in schoolyards, as my fellow panelists have talked and will be talking about, planting street trees, and providing access to bigger natural landscapes like forests and other types of nature, even outside of city limits. And we're at the point in this sort of emerging field of nature and health in which systematic reviews are being produced now on this evidence, including one I was a part of in 2021 on nature and children's health. And this demonstrated the potential of residential green space, nature in school grounds, classrooms, and other types of green interventions to improve cognitive, behavioral, academic, and learning outcomes related to mental health and psychological well-being. And we can see that a large portion of these studies have been cross-sectional. So my work takes a primarily experimental approach in an attempt to learn more about causal mechanisms that may underlie these benefits. There is a lot of value, of course, in cross-sectional studies, too. So the experiences of these natural environments often take place through multisensory pathways, olfactory pathways, auditory ones, haptic ones, and visual experiences. And so these are all relevant in various ways to some of the influential theories in environmental psychology that sort of motivate this work, and I'm just going to talk about a couple today. And they're quite broad, but they're important to know about. So one is stress reduction theory. It's developed by Dr. Roger Ulrich in the 80s and 90s, and this theory proposes that due to our common evolutionary history as a species, our parasympathetic nervous system, or the rest and digest system, tends to engage when we're in natural environments in most cases. And we have affective or mood responses as well. And importantly, we can measure these effects. So we've run experiments using one part of the natural environment, namely urban green space. And in one study, we tested urban and suburban participants before and after 50-minute walks to which they were randomly assigned, either in nature or urban environments, sort of equidistant from the lab with which we tested them. And we assessed self-reported measures of affect or mood, emotion regulation, and a test of cognitive function, and then we compared the ways in which these assessments changed depending upon the environmental condition. And we found compelling, significant differences in the nature versus the urban group and the ways in which their self-reported affect changed. The nature group showed significant drops in anxiety, negative affect, and comparative increases in positive affect compared to the urban group. And we also observed a change in an aspect of maladaptive emotion regulation, or a specific pattern of thinking known as rumination. And broadly speaking, rumination is repetitive thought focused on negative aspects of the self. And to assess it, we asked participants how much they agree with statements like this one: "My attention's often focused on aspects of myself I wish I'd stopped thinking about." And so as a quick sidebar, within a laboratory context, we've studied what rumination can do to physiology, so how those thoughts from the mind can impact the body. And when people ruminate, we've observed increases in heart rate, blood pressure, electrodermal activity, otherwise known as skin conductance, or the way the palms sweat during stress, say, increased respiratory rate, and decreased finger temperature. So these are all signs of sympathetic nervous system activation, or fight or flight system. And within the context of our nature experience study, we observed a decrease in self-reported rumination in the nature versus urban group as well, along with those other affective changes. So in a separate study, using 38 different participants, likewise randomly assigned to the same nature versus urban environments, going for 90-minute walks, we tested them before and after. We also observed that decrease in self-reported rumination in the nature versus urban group, as well as decreased perfusion, blood perfusion, in the subgenual prefrontal cortex for the nature walkers. And this is an area of the brain associated with, among other things, ruminative thought. And this may extend to other aspects of emotion regulation as well. So neuroimaging work from a research group from the University of Mannheim found that exposure to urban green space most greatly benefited those with reduced regulatory prefrontal recruitment during processing of aversive social emotional cues. So in other words, for those individuals, the green space may have served as an external resource to help them with their emotion regulation when they were not able to perform that function as well themselves. So these and many other findings are in line with stress reduction theory. So another theory, developed by Drs. Stephen and Rachel Kaplan, is known as attention restoration theory. And this proposes that an aspect of our attention, known as directed attention, is overtaxed and depleted in urban environments due to the need to block out distractions in order to focus. And natural environments provide an opportunity for a replenishment of this capacity. So there's one more interesting effect that we found from that study example I named earlier that helps to illustrate this. I mentioned we assessed cognitive function before and after the walks. Well, to measure this, we used what's known as the operation span task, or the O-span task. In this test, the participants have to memorize a string of letters while at the same time solving math problems. It's what's known as a dual processing task. It's run on a laptop. It prohibits rehearsing of the letters during the memorization process because of the requirements to do the math as well. And they had to score above 75% on their math scores in order for their letter scores to count at all. And it's hard, and it looks a little something like this. True or false? Letter. True or false? Letter. True or false? Letter. True or false? Letter. What are the letters? True or false are the letters? Yeah, right. Yeah. Well, even if you name the letters, I wouldn't know what your math scores are, so I'm sorry, I can't count it. But we did observe some interesting results here as well. After accounting for the math performance, the participants in the nature condition remembered on average 10 more letters after their walk, whereas the urban group showed virtually no change whatsoever. And this is out of a total of 75 possible letters, so that change is a significant difference. So, not only mood impacts in line with stress reduction theory, but also cognitive function ones in line with attention restoration theory. And findings like this, and there are many others, have huge implications for youth and children, especially within the context of nature in schools. So there's a vast distribution of how much of this nature occurs within and around school grounds, and science is starting to show that this may have an impact on our children's brains and behavior. Just to name a couple studies, one from 2015 in Barcelona showed that the more nature there was surrounding and within school boundaries, the better the students performed on working memory tests over time. Another study found window views matter for students. So after a mentally fatiguing test, students sat with views of either a wall, a building outside, or grass and trees, and those who had the nature view performed better on a working memory test and had decreased signs of stress in their physiology after only 10 minutes. And this is just one study we did, a cross-sectional study. We sampled schools throughout the state of California, and we found a significant positive association between standardized test scores and tree and shrub cover within 750 and 1,000 meters of urban schools after controlling for a variety of other predictors like teacher-student ratio. Another emerging pathway of interest in nature and health is related to immunological and inflammatory outcomes. And so this is informed by the theories and practices of forest bathing, or by Shinrin-yoku, as it's known in Japan, where it originated. And it's also been emphasized in work by Dr. Ming Kuo. So this theory focuses in part on biogenic volatile organic compounds from trees known as terpenes. So plants emit these compounds for defense purposes or to attract pollinators, even as a means for signaling other plants. And Shinrin-yoku posits that they have an anti-inflammatory effect when human beings are exposed to these terpenes through the olfactory pathway. And here again, we can start to formulate how to measure this in the real world. So with support from NIH and the JPB Environmental Health Fellowship, we're measuring the ambient air concentrations of terpenes in the University of Washington's experimental forest known as Pack Forest. And along with this environmental information, we're conducting a randomized controlled trial in the forest to test the effects of the absorbed dose of these terpenes on physiology and biomarkers, including IL-6, CRP, cortisol, and TNF-alpha. And we modulate participant exposure to these naturally occurring terpenes through filters and papper masks. And we measure their physiology continuously, as well as take blood samples before and after their 1-hour sessions. It might look a little uncomfortable and seem like it interferes with those other multisensory pathways I discussed, but surprisingly it's kind of comfortable, and you can still keep a lot of those other things constant while just modulating the olfactory pathway. So each participant sits for a terpenes on session and then also a terpenes off session, counterbalanced order, and with at least an 8-day washout period in between. And then we compare the differences and changes in these outcomes within each participant that happens between these conditions. So here's where larger patches of trees near city limits or providing access to these areas outside of them can play a role in health. So we can see that we've touched on the ways in which nature exposure may beneficially impact many of the negative outcomes I first listed that can come from social and environmental predictors of well-being. And there are other important outcomes that can come from nature contact as well, like positive emotional well-being, eudaimonic well-being, quality of life, and there are other pathways, like increased physical activity, improved social cohesion, and environmental factors such as air quality and temperature. So street trees, for example, have been shown to reduce air pollution to some degree in some instances, as well as reduce urban heat island effect, both of which are disproportionately impact socially disadvantaged and historically marginalized communities in inequitable ways. So one place in which this inequity is stark is in the Tacoma Mall area in South Tacoma. And Tacoma as a whole has less urban tree canopy than nearby communities, and within the city, high heat is highly associated with lower levels of income. So we're conducting work in collaboration with the city, community partners in this neighborhood through the GRIT project, as it's called, Greening Research in Tacoma, which focuses on the ways in which the community has few green amenities while being overly burdened with high heat, and what happens over time when many thousands of trees are then planted in the neighborhood, which will be happening over the next several years. And I'll just end by mentioning that decision makers and practitioners are looking for tools to put this evidence to work in practical ways, including ones that help to address health inequities. So along with many other authors, we recently developed a conceptual framework that shows one way in which we might start to model these relationships between nature contact and mental health using the ecosystem service paradigm through 4 basic steps. I don't have time to get very detailed on them, but broadly speaking, the first is to describe the different characteristics of the nature itself, then account for exposure or amount of contact that individuals or a population has with nature. And it's important to note that this model should account for socio-demographic, cultural, perceptual, and behavioral differences that influence the tendency and ability to seek out and receive nature contact. The next step in the model is to consider the types of nature interactions and experiences that occur with each nature exposure, and finally, to calculate effects based on these previous steps. And so these can range from outcomes like stress, working memory, other aspects of well-being that we just touched really briefly on. And as we can see from the conceptual model here, different individuals and groups may experience nature differently depending on social and other factors, and so effects will differ accordingly. So with this framework, we can imagine potential practical applications in urban planning, landscape design, and other decision-making contexts related to the mental health and psychological well-being of children as the evidence base builds and as we can build this model out. So my JPP fellowship has supported a number of students throughout my time at the University of Washington, each working on different aspects of many of the topics I covered briefly here, so I want to thank and acknowledge them and all of their work. And with that, I'll thank you for your time.
I think we have time for one question.
Hi, I was just wondering if it has to be trees or if garden spaces also work?
Yeah, great question. So that all depends on what we're asking in terms of how I think about that question. So I think about how different kinds of nature impact different people differently and why, and that's why I think causal mechanisms and pathways are so important to understand. So if I were looking at something like connection to nature, say, or knowledge about plants, I might think about gardening different than a walk in a forest. If I were thinking about terpenes and what I think those do, I would think about that differently than gardening. So it really depends on what outcome I'm thinking about in terms of how I approach that question. But certainly there's a body of work on the benefits of gardening, and it's very dense and very interesting. So yes, that is a great nature intervention to be considering.
All right. Well, this is the bitter end crew before lunch. Thanks for staying. And I always hate to be between people and lunch, so we'll try and keep this engaging. Again, I'm Sara Milligan-Toffler. I'm the president and CEO of the Children in Nature Network, and just really want to thank the Picower Institute, Ravi and Sara, and the JPB Foundation for their support of this really important conversation. A couple of years ago, the Children in Nature Network asked children from around the world to share their vision of a more just and healthy future. And we received thousands of submissions from around the world. And what we received really inspired us and challenged us. This drawing by Maya, who is 12, Maya wrote this to accompany her submission. She said, "Everyone deserves the same benefits to a happy, healthy life. Nature is a right we all should have." I'd like to just ask each of you to take a moment in your mind's eye to think about, what does a just and healthy future look like? If we can't envision it, I don't think we're going to get there. We need to have these pictures in our mind's eye. So think about your own home. When you walk outside, what could be there? If you're going to work or taking your children to school, what's in those spaces? What do you smell, hear? What's not present? And I just want to challenge us all to think about this, and I think all of the speakers up to this point have kind of been sort of pointing to this question of, how might our communities be different if we thought about it from the perspective of children's well-being? What if we did that? We could do that, right? I think we could do that. We received lots of submissions that resembled this one. Simran is 9 and wrote that he loves being outdoors, but he worries about pollution and global warming. And he's imploring us to imagine a different future while we still can. And then this one. I love this sweet picture because I think it really represents how children seem to instinctively understand that nature makes them feel better. Gianu is 8, who did this, and she wrote this. Once upon a time, there was a girl named Gianu. She loved the trees, the flowers, the birds, and the sky. It was a beautiful place that she had seen. It was a nice day to see it. And she said, I love this place so much. The birds sing and there is fresh air. This is a calm place for me. I could pretty much just stop my talk right there because, you've heard all of this research and what the science is showing us, but children are telling us the same thing, right? They instinctively understand that access to clean air and fresh water is something that makes them happy and gives them hope and makes them feel calm and less stressed. I'm just going to talk briefly about the Children in Nature Network. We're an organization that was founded in 2007 by the author Richard Louv. He wrote a book called Last Child in the Woods. Last Child in the Woods, helping our children recover from nature deficit disorder. And our mission is to increase equitable access to nature everywhere children live, learn, and play. So we're a national network-based organization, field-building organization, and we really, these 3 interconnected strategies are how we do our work. And the first is fostering belief that a connection to nature is critical to children's healthy development and that access to those benefits is inequitable. People aren't going to do or act on things that they don't believe in. And so we really work to both advance the research and evidence base around the human and nature connection. We collect and curate the largest collection of scientific literature on the human and nature connection that we make freely available on our website, and then we translate that for policymakers, funders, decision makers, practitioners, parents, anyone who wants it. So I encourage you to check out our website. We actually do a monthly research digest that summarizes the most recent research that's coming out, and that's free as well. We also do storytelling because research isn't enough. Research is important. It's good, but we need to tell the stories of communities and what they're doing around these issues and to create a different narrative about what the future can look like. As Annie said earlier, the barriers to equitable access to nature are systemic, so therefore the solutions need to be systemic. So we work in partnership with many different great partners around the country to implement strategies to create transformational change across communities in terms of equitable access to nature. And then we're working to grow this movement, a more diverse and thriving and vibrant movement. And so I hope if you're not already part of our movement, that after this talk you'll be motivated to join with the thousands of people around the country that are working on these issues. And just want to share, I mean, we are by no means the only organization working on transformational change in these issues. NSA's wonderful organization is doing that, and many others are. But these are the 50 communities that we're working in across the country that are working to implement transformational strategies to increase equitable access to nature across their communities. And I'll talk about what some of those strategies are in just a minute. I'm not going to spend a lot of time here. I think it's been well demonstrated that kids in our country are not doing well. We know that there's a mental health crisis, and we can and we need to do better by our children. So what I'm going to talk about for the next just couple minutes here are what we are seeing as the benefits of connection to nature, both as a therapeutic intervention when there is a mental health issue going on, and then how nature can serve as a protective factor, like Greg talked about, to create resiliency and to allow people to be able to bounce back from difficult situations. The Children in Nature Network has been working for the last 5 years, I believe, with Casey Family Programs, which is the largest provider of mental health services to kids and families in the social welfare system. And their own research is telling them that their traditional therapies, primarily talk therapy, while helpful, is really insufficient for the kind of rewiring that needs to happen in the brain to heal from trauma. And so they actually approached us because they had some social workers that had kind of gone rogue and just started incorporating gardening, outdoor walks, even in some cases family camping trips into their practice. And they were seeing results that they couldn't explain. And so we have been working with them to try and understand the research at the intersection of ACEs and what we know about the benefits of regular connection to nature. And so the result is kind of summarized on this benefits wheel here, if you will. And we know that nature actually supports all of these factors that support healing from ACEs. So the healing, the stress reduction, positive affect and mental health, a sense of permanency and connection to place, family, better family connections, a sense of safety, and then the ability to self-regulate. And I'm actually, there is an extensive literature review that we did that is available if you click on this QR code. So I'm going to pass these out. Just you can take some and people can share them. But if you're interested in really understanding more in depth what the research showed, it's available on our website. So now I'm just going to spend a couple minutes talking about what kind of solutions, what are the recommendations based on what the research is telling us. And first, as I mentioned, the research really does point to nature being an effective therapeutic intervention when a mental health crisis is present. And the first recommendation around this is really to add nature to pediatric health care facilities. There was a 2020 review of studies from multiple countries that was really looking at what are the environmental factors that in an inpatient setting can promote health and healing. And the most commonly mentioned feature that was mentioned as being highly beneficial was gardens and green space. And not surprisingly, based on what we've heard today, they saw reductions in stress and stress hormones, and young people reported feeling a greater sense of agency about their own healing journey. The second recommendation is to integrate nature into physical and mental health care programming. And so, there are a number of studies that have looked at this. And I'm not going to go into a lot of detail, but I will share that mentioning Casey Family Programs, we have been working with 5 of their sites around the country and with their social workers to integrate nature-based interventions across all of their services with kids and families. And not only are they seeing really positive outcomes and changes in, some really, some young people with some really challenging behaviors and situations, we're seeing that the healthcare providers themselves are starting to integrate these practices into their own self-care. And these are people that, when we showed up, they're like, you want us to do what now? Like, cated kids outside, like that, how is that gonna help? And they've started to see it, to witness it, and to experience the benefits themselves. And the third recommendation is increasing opportunities for young people to interact with animals and plants. And the research is actually really interesting around this. There was a study in 2021 that took place in an elementary school in Dublin, Ireland, where children were caring for hens. And again, unsurprisingly, the results of that research, they saw gains in a sense of responsibility, in empathy, in care for the environment. And anybody who has, a household pet has probably seen this in your own children. And then, the other piece that we want to, that I'd like to talk about is how nature can really serve as a protective factor against ACEs and other daily stressors. And how, if we thought holistically about our communities, and I love that graphic that you showed, Greg, that really kind of gave a visual picture of what it could look like to have, more nature integrated in a community as really a public health strategy. And so the first recommendation, and this lines up, I think, with what we've heard today, that comes from the literature, is really around increasing greenness where people live. And, there was, I wonder if it's the same nurses study, but there was a study that's called Growing Up Today that had 11,000 kids of nurses that were studied over a 17-year period. And what they found was that the kids that lived in greener neighborhoods reported less anxiety, depression, and other issues in adolescence and early adulthood. And then the second recommendation is school grounds. So this is a huge theme that you've heard this morning from this group. I won't talk a lot about this, but one thing I do want to share that I don't know if people know this. Public schools in the United States, in most communities, are one of the top 3 landholders. In Chicago Public Schools is the second largest landholder in the city. How we use that land matters. Much of it today is covered in blacktop, asphalt, concrete, or at best turf grass, which is not really helpful. And so if we really reimagined those spaces for all of the benefits for the school community, the surrounding community, and the environment, we could make a huge impact. Lastly, I'm just going to share a couple of promising practices that we're seeing from around the country. Park library partnerships are starting to spring up. Folks are using libraries as a jumping off point for connection to nature through outdoor story times, story walks, and even nature backpacks that you can check out of the library. We're seeing many cities start to adopt children's outdoor Bill of Rights. And this can really serve as a great platform and vision to bring the community together to support implementing some of the kind of strategies that I've talked about here. We're also seeing nature exploration areas in city parks. A lot of our city parks don't have that much nature in them. And so, the city of San Francisco, for example, has got a plan to create nature exploration areas across their city park system. And the last piece that we're really seeing is the greening of early child care centers, as we saw that importance of those early years and the developing brain, making sure that young children have access to really nature-rich places to explore and play is so important in their early development. So thank you, and I hope I've helped to spark your imagination a little bit here, and that there are things that we can do to create a more just and healthy future for our kids. So thank you.
Okay, so I think we can have maybe one or two questions directed to Sara, and then we're all gonna sit down and have.
We can just move over there.
Is that okay?
Yeah,
All
let's
right,
just
then
do it.
We can just go straight to the panel discussion then. So why don't we start with the questions that we're going to be asked after Sara's talk.
If children don't have access to outdoor green spaces, is there any benefit to indoor spaces filled with plants?
The simple answer is yes. I mean, there's some research, actually, one of Greg's colleagues at the University of Washington has done a lot of research, Peter Kahn, on technological nature. And, what that has found is like mechanical dogs, screens that have trees on them, can provide some positive benefit. I mean, real nature is better, but houseplants and those kinds of things are hugely beneficial, yes.
Who it was. Thank you so much for your presentation and moving us into thinking about intervention and recommendation space. So I think at the municipal level, I live in Boston. I'm from Chinatown area, and I think a lot of the initiatives to address climate change and children's health is now like focusing on nature-based interventions. But back to your presentation, Dr. Belcourt, like you got to talk about systemic factors, right, and address that, right? The privatization of land, the lack of like access to quality air. So is there a way that you could create like a hierarchy of recommendations in which we really need to address the systemic factors, right? Like the zoning policies and then build onto it and not just focus on, because at the municipal level, funding is really short, right? So you can't just put all your pot into planting trees or gardens when I think that might not last in the long term. So what are some of your recommendations?
Thank you. I've got a couple ideas. So the General Accounting Office for the government periodically puts out reports on status of our public schools, and since schools have been talked about a lot. And what we've learned is that, there's some schools that are barely opening their doors at this point. They've had major maintenance issues, major ventilation issues, and this is well before the height of the COVID pandemic, keeping books in their libraries, all the basic necessities of a school functioning. So even in the best of interest and intention, there's just so much of a heavy burden on our schools already. I think that we just have to get real about not self-imposing what certainly works in other places of our country that have already different levels of capacity. Maybe they're on the upswing of that percentage and already have some of their basic needs met, and now they have the capacity to bring in volunteers and help out, because you're right, sustaining these programs is a whole nother thing. So I would just caution that the largest systemic concern here with our learning environments is making sure that they need help with their environmental indoor and outdoor air quality and the various other ways of exposures for environmental exposures overall, and that these practices we're talking about are wonderful, but let's make sure we help these schools where they're at, where they need, and then help them continuously on the trajectory. So that would be my answer to prioritizing. Depending on where these schools are at, let's meet them where they are, but there's always going to be work to do. It doesn't mean that we don't work on community gardens and in other wonderful aspects, butterfly gardens and many other wonderful ways that teaching mechanisms are being used in our learning environments, but let's just also get real about the capacity that's needed. How do we give additional capacity for those schools that are on the lower side of the spectrum and, in my opinion, have been kind of missed periodically, all too often?
And I would add, it's on, right? Yes, okay. I would add one other piece to it about interventions on the kind of built environment scale, and that is what I'm sure we all know, which is to be sure to speak to the communities and the community members themselves about what they themselves want. So before we're even examining the impacts of a huge tree planting effort that's going to be taking place in Tacoma, we're working with and hearing from the community about their needs, wants, preferences, and concerns about that tree planting effort. And so it's not a one-size-fits-all, we know this is going to benefit in that way kind of situation we're in. It's not top-down. It needs to be bottom-up and built on those conversations. So.
So I have a follow-up question about that. So what do you each think is the biggest barrier currently to incorporating nature into children's lives? And this can be anything, from lack of research, political, economic, cultural influences, sort of very open-ended question.
It's not a lack of research. Or what people know. I think a lot of it is political will. I think there is a scarcity mindset. There's a belief that we don't have the resources in this country to do the things that we know work. I challenge that. I think that if we think creatively, I'll just give an example that, we're seeing in cities that we're working in across the country, the resiliency office, the public health office, education, water department are all coming together to come up with shared solutions that meet multiple needs of the community. And so that, I think, we often think like, oh, it's the Parks Department, and the Parks Departments we know across the country are massively underfunded. We say we love our parks, but if you look at city budgets, we don't, because we don't value them. But if we start to think about the outcomes that these kind of interventions can support, there are many, many more stakeholders that can be brought to the table to help implement these solutions, while also making sure that there's, transportation, access to food. We can't just think about one need that kids have. So I think economics becomes a huge barrier, but I think there are creative solutions.
And I would just add, we have a huge crisis in our public health workforce. There's going to be a lot of retirees very soon. And so you already have the buildup of our professional workforce and those that are going to provide the type of quality assistance and technical assistance needed for any of these programs to be successful. But the funding mechanisms traditionally have also been very siloed, as well as the work itself. So we really need to break those. The work that we're talking about really is comprehensive community health, in my opinion, right? These should not be add-ons. It should not just be the Forest Department's burden, if you will, to figure out connections to nature for the current and future generations of our children. This should be a comprehensive, how do we look at our communities in a much different way, in the type of vision that you encourage us. And to your point, Greg, there are too many examples where self-imposed ideas or maybe pre-funded ideas are then brought to a community, and then the community is like, that's not what we need. That's not even realistic. I've been brought in many times to be a technical advisor on a project, and they're scratching their heads, why didn't this work? Well, did you think about the level of crime in this community? And so having an after-school program, it's wonderful, but how do you get them there? Because the mom that's still at work is not comfortable just sending her kid out in that community. We got to think about the beginning, the end, and the middle. So again, every community is going to have their own needs, and it doesn't discount the other societal ills that need to be addressed, but continuing to unfortunately create or assume that there are certain programs that are only going to be viable for certain communities or those that can afford it is not the way, even unintentionally, we want to go.
Yeah, and as an addition to both of these excellent points, also, we all know our cities were built a certain way over time. And so that's a major obstacle to figuring out where and how to increase the ability to have regular contact with nature. We speak about it in almost ecological terms in that model paper I talked about configuration. So on the landscape, where can we put these natural elements that people will be either passively or actively coming into contact with? And that's where, big landholders like schools are going to play a key role. But we have roads and other kinds of infrastructure that are major physical barriers as well.
Thank you. Thank you so much for the work that you're doing, first of all. And second of all, my question kind of leads on from what you were just speaking about in terms of, like, when we think about access to green spaces, and in particular natural green spaces, I think a lot about public transport and how infrequently hiking trails or forests are on those bus routes or on those train lines. And I'm curious to hear if any of you in your various organizations have had encounters around that with policymakers and what that kind of feedback was from them.
I'll jump in with one good example on that. There's a program in Seattle called Trailhead Direct in King County, and it was designed in part to sort of alleviate traffic congestion at trailhead parking lots, but it's also served a role in increasing access to those outside of the city limit natural areas, those big nature areas that are really important to think about. But I think it's a great point. I'm not sure if you have other examples.
I mean, state parks, national parks, those kinds of areas are wonderful. But at least what we see in the research is that daily contact with nature is what really impacts health and well-being over a lifetime. And so what we're really advocating for, in my presentation, what's happening around where people live. When we're doing housing projects, how are we ensuring that we're thinking about the green space that the people living in that environment need? Schools, library, just everywhere. The way we think about it is everywhere children live, learn, and play, and ensuring if we can integrate it there, then I think we're meeting a lot of the needs of the children. So.
Yeah, to your point on policy leaders and their reactions, I have yet, I'm sure none of us have ever actually confronted a policy leader, regardless of what side of the aisle they're on, that says, I'm not for kids, at least in public. And yet our actions do not equate, right? We are not funding, less than 5% of our gross domestic product goes to children's environmental health for groups that are starting to track this. It's not just money, it's capacity, it's attention, and it's a matter of us being these issues collectively. And I would say our lack of putting children first, as we've been saying, in all that we do, and the protective nature that creates by creating a frame in that way that we have yet to do. Why don't we try it? So I have not heard pushback. We're right on Capitol Hill, we're out there often. Rather, it's always accolades for programs like this, and yet the follow-up never, all too often, does not also mirror the words.
So I'll just say, I know we're running a few minutes late, maybe just time for one or two more questions.
Hi, thank you also. I'm a 33-year high school math and science teacher, and actually next week I'm on a panel for Anxious Nation, a new documentary that's going to be shown in our area, and I'm kind of cramming right now. I'm cramming for the event right here. Thank you all. And I know I'm going to be asked, I've done a ton of research, and I have a degree in mind-brain teaching from Hopkins, but I know that we're in a very forest-rich, lush, beautiful community where my school is. So and our kids are in crisis. We've had 3 deaths by suicide in the last 3 years in our community. Ooh. And so, what's going to be your one suggestion, your top suggestion when they say our kids are so anxious, our beautiful teens are in such crisis? What's your number one choice, recommendation for relief for that community?
I have some of those anxious teenagers in my house. I'm going to go pick one up from college tomorrow in North Carolina. One thing we haven't talked about here are the school shootings. The number one reason now for death of children has now surpassed cancer, and it's gun violence, right, in this country. It's very real. All of these are very real, and our kids coming up after us are going through things that I didn't even have to begin to digest. My humble opinion is we have to meet all these kids where they are, just as I would suggest the various approaches also need to meet the entity that's supposed to harness and support the work where they are. So if children do enjoy going outside and being close to nature, let's encourage more of that. If they do enjoy some type of meditation or some type of activity, physical activity, let's think about how we can support that. If they do enjoy arts and music, how do we do that? So I would say first start with where their interests are. And can those interests be then linked eventually to the co-benefits of being outside or exploring nature? Maybe that's not it for them, but maybe hopefully there's other outlets. I think what we're all trying to say here is that this is one of many different ways that public health can be benefited, our environment can be benefited. It doesn't have to be the exclusive, but it does show, the science and lived experience does show it works, and we have yet to really put these type of strategies at a level that could really test the viability of the benefits.
Right, one more question, and then we'll break for lunch, if anyone else wanted to ask.
Thanks, this was super interesting. I get this applies to all the research we've heard so far today, but I guess I'm wondering like how you think about the role of science and providing this information when you have a lot of leaders who do not care what the science says. Like it's not as simple as just saying like, hey, the research shows that nature is good. Then they go, oh, I'm sorry, I didn't know that, I'll fix it. You know, like a lot of them don't care and in fact do the exact opposite. So like, yeah, and like you even mentioned, we have a lot of research already. Like,
Yeah, I mean, I'll just mention the Children of Nature Network funded a return on investment study on green schoolyards. Denver Public Schools has one of the longest running district-wide green schoolyard programs, so we have some longitudinal data coming out of there. And the results are actually pretty startling. We're seeing that math scores went up 8 points. If you can move scores by 2 points, that's considered revolutionary. Writing scores went up over 5 points. And then we're seeing, the heat on the hottest days was reduced by 15 degrees. I was talking with someone at NOAA, and they're like, that isn't even, like, when we're trying to, reduce heat island, we would never consider numbers like that. So I think one thing that all of us need to be able to do is to talk in different languages. And in some cases, we need to talk about the economics of it. Like, this just makes economic sense. If you invest $1 here today, it's going to save you $10 down the road. These are solutions that make sense. That's one strategy.
Yeah, and that was just building off that, the impetus to design that psychological ecosystem service model is to speak in quantifiable terms. It doesn't always have to be dollar terms, but quantifiable terms, so that with certain audiences that language is most impactful to use. We can do that with this evidence. So it's a matter of how are we harnessing and operationalizing the evidence for different audiences.
I would just add, every policymaker is impacted one way or the other, whether they realize it. Their own grandchildren, their own children, great-grandchildren, people in their community, people they love and care about. Whether they're attributing that to the bench science that we're attributing to is really, in my mind, not as important, but all these other factors are. And if folks are choosing to avoid the hard data that we use for other aspects of our society, budgeting and deciding what schools get what and what communities get what, it's like you can't do it on one side and not do it on the other. So it becomes frustrating that we have to continue to be these voices of reason and connecting the dots for folks. But thankfully, it's becoming easier. And I think we do need more health economists on our side to help us in the money side of it, but not being the only quantitative indicator.
Okay, so I just want to thank you all again so much for coming. I'm sure they would be happy to field more questions at lunch, so if anyone didn't get a chance to ask their questions.